Preparing for an IUI cycle. Hi friends, I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI. I'm a fertility doctor, and today we're talking all about what an IUI cycle is, when you should do it, and how to prepare for it in this quick video. As always, I appreciate you so much, and I'm so excited to see this channel growing. Please subscribe, share, comment down below so I can know what questions you have. This channel exists so that you can learn more about your body, your fertility, and your health, and that you can advocate for yourself better in a healthcare system that's not always the best. So without further ado, we are going to jump into what is an IUI. IUI stands for Intrauterine Insemination, and a lot of people refer to this as artificial insemination. But what we're doing is we are taking a sperm sample, we are processing it because the sperm that is ejaculated, the ejaculate protects the sperm sample from the acidity of the vagina. So the vagina is acidic, the sperm is alkaline, and that ejaculate is alkaline, and it has a lot of protective factors. So you couldn't just take that sample and put it inside the uterus, or you would have a huge inflammatory reaction. So what we're doing is we're processing it. We actually take the sample, clean it at centrifuge, and get a pellet of the sperm, and then reconstitute it so that we get this concentrated sample that's lesser volume. Uterus doesn't hold that much. And then we're able to put it into a very small catheter, and we're able to push that through the cervix into the uterine cavity and deposit the sperm there. And this should ideally be done on the day of ovulation or when the egg is en route. So what's important here to understand is that I use terrible analogies. So I like to think about an IUI like taking your players and moving them further down the field. There's some important things about that. If your players are injured, let's say all the shape is off and they don't move well, yeah, they're not going to move well down here and they're still not normally shaped or they're still injured. If you don't have enough players, simply moving them may not be enough. You still have to have a certain number of sperm to help fertilize the egg. So there is a lot that goes into getting pregnant besides just moving the sperm where it needs to be, although this can help for certain people. So I think it's really important to understand what it is, what it isn't, and who's a good candidate for it, in addition to preparing you for the process the best. So we're going to go through all of this really quickly. An IUI can be used for a few different reasons. One can be used for what we call absolute male factor or a need for donor sperm. This is when maybe you're in a same-sex relationship, you are single, or you are in a relationship with somebody who doesn't make any sperm, which actually can happen. You can go in for a semen analysis, and there might be a circumstance where there is no sperm. I've also had patients use this when they've previously had a vasectomy and desired not to undergo IVF or a vasectomy reversal, and they would prefer to use donor sperm. So donor sperm exists as an option to help a variety of different people get pregnant. The other group that it helps is people who have been trying to get pregnant who are having infertility. And this can be if there's a mild male factor, asterisk on mild, or if we fall into the category of unexplained infertility, but only with what we call superovulation. So understanding these groups are important. If we're just replacing sperm, like it's not there, you're not having intercourse for X, Y, or Z reason, and now we're putting sperm there, you have your age-related chance of getting pregnant. So ultimately, you're getting up to the chance of natural fertility, but not over. This means that for somebody who's 30 years old, that's going to be about 20% maximum per month. If you have infertility, however, your chance is now lower, and we're trying to get you closer to that natural level, but we're not going to because something is going on. So typically when you have infertility, we're trying to get you closer to about a 10% per cycle chance of success. And that does depend on age and other factors. And again, some people are not even candidates for IUI. I explain fertilization because fertilization still has to happen in the body. Remember, the egg is released and it lives for 24 hours. It has 24 hours for that sperm to really get to the egg, and then the sperm have to exert pressure and force to allow the one sperm to get through. And so you have to have a certain number of sperm to get this job done. Those very low sperm counts are not even good candidates for an IUI. But when you have a mild factor, maybe they're just not moving well, but there's plenty of sperm, then IUI might be something that can help. In the category of unexplained infertility, normal sperm parameters and you're ovulating a normal anatomy, your chance of getting pregnant per month has dropped down to 4 to 5%. And IUI is going to help try to get it up to about 8 to 10% per month if we combine it with super ovulation. So trying to get your players further down the field and having two goals is just going to increase the odds of making the shot. So that means typically taking a medication like Clomid or sometimes letrozole in combination with the IUI. If it's just for a male factor or an absolute male, you might be doing the cycle completely unmedicated or natural. It's important to let your team know if your periods are not perfectly regular or you have a hard time detecting ovulation, that may not be a good cycle plan for you. So discuss with them if they say, well, you just don't have sperm, so we're just going to put it there. Call me when you ovulate. Well, how are you going to know when you ovulate? And what if your periods are irregular? So, in order to qualify for a natural cycle IUI, you need to have nice, regular, reliable periods and be able to detect ovulation or have your clinic do an ultrasound. We're a big fan of ultrasounds because I'm controlling, so I want to know. And we're basing when the follicles mature, looking at the lining and the follicle size, and then we're utilizing a trigger shot. And the trigger shot is going to replicate the LH surge from the brain, and this is going to allow the follicle to rupture and the egg to be released. Because that egg can be fertilized anywhere in that 24-hour period, and because sperm live in the reproductive tract for up to 5 days, a very interesting study showed no different success rates if your trigger shot was the day of your IUI or the day before or 2 days before. So when I first entered this field, we were very OCD about how many hours from trigger shot to IUI, and I'm not anymore. And I recommend you're not either. As somebody going through it, just try to trust the process. So, questions to ask along the way is this going to be in an ovulation induction cycle or is this going to be in a natural cycle? Is this going to be with a trigger shot? And that can apply to both. Am I going to have ultrasound monitoring? Am I going to use progesterone afterward for luteal phase support? Not everybody does this. I'm a fan because it's low risk, it's something easy. And there's some evidence that if you're growing an egg with medication, it might not make as much progesterone as it would naturally. For me, it's one of those factors we can control. But I've definitely worked places where that's not the standard. But knowing what to expect is important. I also think it's really important to understand how long you should abstain before the sample. So, should you still have sex during the cycle? Should you not? How long do they want you to abstain? Standard is abstaining 2 to 3 days before the IUI sample so that you have enough. So, I will usually tell my patients have intercourse this day, then no more until the IUI, and then afterward, intercourse is recreational. Another good question to think about if you're going through the process or something to prepare you is to know how many you're going to do and what are your expected chance of success per cycle. And I would ask my doctor that. I've seen so many patients do cycle after cycle where their chance of success was just dropping, dropping, dropping. For unexplained infertility, most of the time we're not doing more than 3 cycles. If this is a combination of an ovulatory factor or mild male, we might go up to 6 pending your age. But going further than 6 cycles is really spending a lot of money. And I'm questioning if that's the best thing for you, fitting your age, the family size you want, and the full picture. Because at that point, after doing 12 IUIs, you could have paid for IVF. Another thing about IUI day itself is that the IUI is pretty straightforward. I'm going to compare it to a pap smear. A speculum is going to go into the vagina, and a tiny little catheter is going to be placed through the cervix right into the uterus. When the sample is being injected, some people feel a cramp and some people feel nothing. You'll often lay there for 2 to 5 minutes afterward, although there is no evidence to support that. And then you're going to get up and go live your life because embryos and plant eggs get fertilized while you're out living your normal life. I like to tell my patients, pregnant until proven otherwise. So during the cycle, we're convincing your body that this is a good month to be pregnant. So eat nourishing foods, lots of fruits and vegetables, avoid things that cause excess inflammation, get good sleep, move your body with purpose, but focus on more lower intensity work. Don't be going crazy with the HIIT exercise just exactly in this moment. So take that approach and that good mindset. I find having boundaries, knowing how many you're going to do, and then knowing what the next plan is going to be is really helpful. And then my last piece of advice is ask your doctor, is this a good plan? Or should we skip IUI and go right to IVF, considering we're this old and want this many kids? Sometimes places are so protocol, they're just going through an approach. Do IUI this many times. If not pregnant, then do IVF. but that may not make sense for you and your goals. And it really is a full picture assessment. So I can't answer that for you on this side of YouTube, but you should ask your doctor that question. All right, well, ask your other IUI questions below so that I can answer them. Hope this video helped. Please share and subscribe. And you can always get more information on the As Woman podcast. Thanks, friends.